Hey there, I'm Dr. Dane Happney, physical therapist at Healing Motion Physical Therapy, and I wanted to talk to you about the best pain and feel-good medicines. This was spurred because I was leaving the gym this morning, still in my attire here, and I was driving and I saw a sign from a CBD shop that said, free CBD sorbet with purchase. And I'm sure that sorbet is delicious, and I'm sure it makes you feel good. But I got to thinking, what are our thoughts on pain management and what the best way is to do that? So for me, I think the most important part is that you have habits long term that you are in control of that can help you feel good and manage pain and just overall have health, because when we don't have health, when we have health issues, we can't do the things that give us joy in life, like spend time with grandkids, etc. So I just kind of wanted to educate you on a few things. So CBD, what's the big thing about CBD? So CBD, and I did have to research this a little bit, CBD affects our CB1 and our CB2 receptors. And what those do is they essentially make us feel good. They can, when you have more of those levels, you can have less pain, better controlled appetite, better mood. When you look at it in research, guess what else can affect CB1 and CB2 receptors? Bada bing, bada boom. Exercise, right here, okay? And then one common theme is gonna be that when we rely on bringing stuff into our body that our body didn't produce, our body can what is called down-regulate. And basically, it can then produce less of it itself, because you're not teaching your body how to produce it, something else is producing for it. Think about ducks in the pond, right? Why are there all the signs that say don't feed the ducks or don't feed the animals? Because they stop learning to find food for themselves. That's exactly what our body does, it down-regulates. So if you're giving it CBD, it's gonna rely on more CBD for you to give it, and it's not gonna produce as much itself. And so versus if you produce it with exercise, your body learns how to produce it and produce it even more efficiently. And so you're actually better off. So exercise does the same thing as CBD. So don't get me wrong, this totally has a place. When you have pain that is limiting your ability to exercise, this can maybe help you feel better, but use it to exercise more. And exercise, as recommended by the American Heart Association, can be as simple as 30 minutes of moderate activity, which is a brisk walk or a brisk bike or a brisk sitting doing some arm work 5 days a week. Okay? Or you can, for those that really like to crunch on the time, you can do 90 minutes, 30 minutes, 3 times a day of vigorous exercise to meet the recommendations. Okay, so that's the overall arching theme that we'll keep hitting. Okay, then we get to ibuprofen, vitamin I, love it, take it, feels so much better. So ibuprofen affects your COX-1 and COX-2 inhibitors versus something like Tylenol just affects your COX-1 inhibitors. So the reason that ibuprofen can affect your stomach is the COX-2 receptors are also in your stomach, and so if you inhibit them, that can affect. Now, the problem with ibuprofen is it is being shown more and more that it can delay your strengthening effects, and it can also delay bone healing and tendon healing. The literature is starting to mount on that. And the reason is because you're inhibiting inflammation that your body normally produces. There's a reason we have inflammation. Inflammation is good at the right amounts to help facilitate healing. So if we try to take that inflammation and that healing away, we actually delay our healing. So ideally, I try to recommend to avoid ibuprofen on acute pain. If you can, try to manage with Tylenol, just because only doing the COX-1 and not the COX-2 is ideal, and the research is more on ibuprofen, not Tylenol, as far as that delaying. If you have to take it to get by and move more, go for it. Now, I don't necessarily know that exercise affects these inhibitors so much, but we'll move on to our next one, and you'll see why wouldn't you just exercise. So if you really want to knock out pain and you didn't care about side effects, would you take ibuprofen or opioids like oxycodone? You would take opioids like oxycodone because it is clearly the bigger bang for your buck to get down pain. Now, how those work is they just flush your system with opioids, which are good just the feel good. It helps knock down those pain centers, and so you have less pain. Okay, so guess what else can help increase those opioids, as well as just all the other feel good factors like serotonin affect your cortisol levels and everything? Exercise, common theme right here, right? Again, on opioids, what's the problem with it? We build an addiction to it because your body downregulates and forgets how to produce its own, and you rely on more, and then you require more and more to produce the same effects. Where does that downregulation not happen? When you get your opioids through your exercise. So again, exercise, natural. Now again, not gonna, like, opioids have a purpose, like post-op surgery acutely, like you need that because you can't produce those exercise effects because of your pain and everything. So again, they have a place, but long-term exercise is it. Then we get down to, and then with that, again, exercise, like if it produces those opioids and serotonin, that like trumps the COX-1 2 inhibitors. So, you know, exercise for the ibuprofen, check. Okay, so then antidepressants, right? So there's, I think, 9 different classes, but SSRIs, serotonin reuptake inhibitors, are one of the most common, okay? And guess what produces serotonin? Exercise. And so again, exercise, great for managing depression. Now, I'll definitely pause here. So there have been numerous studies that show when you do have physiological depression, which you just physiologically in your brain, you can have issues with that serotonin production and its effects, and so exercise might not be as effective for you. And the research is pretty clear that if you are depressed and you feel like you've been depressed in the last 2 weeks or 30 days, and you feel you felt down and hopeless, and you feel like you would like help with that if you see your physician and they get you squared away with an appropriate antidepressant medication and in conjunction with therapy with a counselor, that is the most effective to manage depression. And they've compared that to exercise. So that is important to know. That said, you do that in addition to exercise, which is also producing serotonin, win-win. Okay, so then ultimately exercise, right? That consistent, 30 minutes moderate activity or 30 minutes of vigorous, a little less frequently. That is going to be huge because it's creating all these effects. You don't get that down regulation and that reliance, and you're in control. Now, the other kicker, what none of these touch, I'm talking none of them, are the primary mortality rates in the United States of America. If you look at the 2017 stats that came out by the CDC, I believe, in June of 2019, it took them, a year and a half to process those stats. The number one killer was cardiovascular disease. It was around 650,000. So that was the number one. And that is mostly preventable. Now, don't get me wrong, there are definitely some genetic issues that occur. Cardiac myopathy is a thing, and that can be congenital. There's some other issues and just freak events, people that are running marathons that didn't have the cardiac myopathy that have a heart attack, right? So things happen, right? But I would say by far the majority of those things could have been preventable. And so I would say exercise is one of the primary things. Definitely diet has a big role too, and sleep and all that kind of stuff does play a role. But exercise is the number one thing. None of these touch cardiovascular disease, other than that opioids can actually depress and make you more at risk for having an issue. But exercise is key. Then up there was cancer, which is just terrible. Thank you for the physicians and all the research being done to help with that, right? But if you do exercise regularly and you're stronger, your body is going to be more ready to handle the nasty effects of chemo and all of those drugs that are unfortunately necessary. Then up there on the list are lower respiratory diseases, which the healthier your lungs, the more you'll be able to fight that. Again, some genetic, but exercise will fight that. Flu and pneumonia, stronger your lungs, the better you'll be able to fight that. And then strokes is a big thing on there as well as far as causes of death. Again, some of that is just genetic and it's just unlucky, but the stronger you are, and then again, if you decrease your cardiovascular risk factors, you are at much decrease for strokes. And then lastly, diabetes is a big issue. It doesn't necessarily lead to ultimately like cause of death, but it is a huge issue. And again, exercise along with diet and nutrition is one of the best ways to fight that. So all that to be said, we are always seeking the wonder drug of like, how do I manage my pain and all of that? And really the answer is exercise. It affects all of these things, not to mention all the other things we talked about as far as cardiovascular risk factors and whatnot. So your wonder drug, it's here, it's been here, it's exercise. Now I know that it's hard and that you see shows like The Biggest Loser or whatever it may be, and you see all the crazy Instagram and CrossFit stuff and all of that, and like you don't have to start there. Like start by walking, like riding your bike. Start with 15 minutes instead of 30, maybe 15 minutes twice a day, and just get that consistency. If pain is limiting you, there are tons of physical therapists in the community that are experts at pain and movement and will help you get there. So all that to be said, pain is your wonder drug, or exercise is your wonder drug for pain, and it just will help your overall health. That isn't all of the story. It never is. On our 6 pillars of health, we do say that there's spirituality, faith, mindfulness is number 1. Number 2 is relationships, going well with that. Number 3 is sleep. Number 4 is stress management. Number 5 is nutrition. And number 6 is movement and exercise. And they're very strategically placed because you do need those other things in place to just function as a human being. But exercise is on there. It's super important. If you get that right while you're working on the other things, you will be in a good spot. So hope that helps. Thanks for listening and watching. Make sure to follow us on social media, Facebook, Instagram, Twitter. Check out our blog. We will just keep pumping out content like this and related ebooks and all of that. We love all of you. Our goals are love, growth, grace. You have all the grace in the world for us if you've been struggling in this area or if you've been utilizing any of these things. It's hard. So you have all the grace in the world from us. We would love to come alongside you, love on you, help you grow in these areas, and that's what our values are all about here at Healing Motion. So thanks for watching. Get out there and get some exercise going.